Welcome to the Connecticut Health Policy Project's video primers on health advocacy tools. This second video in the series is about Connecticut's legislative process and how to make your voice heard in it. This quote, "People who love the law or good sausage should never watch either being made," is often quoted at the Capitol. Making laws doesn't always happen the way you learned it in school, but it works pretty well most of the time. If you take the time to learn the basics and respect the process, you can be a very effective advocate. Legislative advocacy, passing bills into law, is often what people think of first as advocacy or lobbying. It's an important part of policy making, but only one part. The legislative process is far more open and transparent than other forums for health policy making. Legislators are elected and they answer to the public every 2 years. The rules require opportunities for public input. They may not be easy to find, but they're there. Some general principles are helpful to remember when advocating with the legislative branch. Be patient. It's rare that a bill passes in its first year. There are good reasons for that, and the feedback you get from that first year can help you adjust and succeed next year. Everyone has their own perspective. Everyone cares very much about their own issues. Even your opponents have a valid perspective. You'll be more successful if you understand them. You need to learn about the system and respect the rules, written and unwritten. Find people with experience willing to help you and take their advice. Remember that you're creating relationships. Even when your bill passes, you will likely be back again. Never burn bridges. It's best if you can offer solutions. Identifying problems is only half the job. Respect your lobbyist. If you're fortunate enough to have the help of a professional, work with them. How a bill becomes a law, the process. An important thing to know is that there are thousands of ways for a bill to die. Bills need tending to survive the process. In Connecticut and most states, bills need to be sponsored by a member of the General Assembly at the beginning of the legislative session in January or February. Once it's filed, it goes to the committee that handles that issue area. For Connecticut healthcare bills, that's generally Public Health, Human Services, or the Insurance and Real Estate Committee. A screening committee of that committee, headed by the co-chairs, will decide if it gets a public hearing. That's your chance to testify in front of the committee and make your case. After the hearing, the bill comes up for a vote by the committee. That has to happen before the JF deadline, the joint favorable deadline, or the bill dies. Then the bill moves to other related committees and must pass each of them. Then, if by some miracle your bill makes it this far, it needs to get on the calendar in each house, come up for a vote, and be approved by both the House of Representatives and the Senate in exactly the same form. If someone puts an amendment on your bill and it passes, it has to go back to the other house. Some bills attract lots of amendments. Some get amendments that delete all your original language and substitute something entirely new. If your bill and your language survive all of that, it goes to the governor, who can sign it or not. So how does anything survive that gauntlet? The answer is generally with a champion. Someone inside the process, often a legislator, who shepherds it past barriers. Only insiders are behind the closed doors where decisions are made. Another barrier can be the fiscal note. Written by fiscal staff, if the fiscal note on the bill predicts that it has a large cost to the state, that can kill it. While state agencies don't have votes in the General Assembly, they carry a lot of weight. They can often kill your bill behind those closed doors. Bills can also just become victim to the clock, just not coming up for a vote in time before the session ends. They can also die because of politics, old scores, and other baggage that has nothing to do with your issue. So how do you get a bill through all that? By learning the rules and customs and being diligent. There are some rules for navigating the Capitol and the Legislative Office building. Be professional, dress for comfort, bring copies of your fact sheets. If you're testifying, check the public hearing notice to see if you need to bring paper copies of your testimony or if you can submit it electronically. There are 1,440 registered lobbyists whose job, at least in part, is to advocate. There are lobbyists for insurance companies, hospitals, doctors, drug companies, businesses large and small, and for consumers. Lobbyists are required to wear badges identifying who they represent. In hearing rooms and galleries, turn your cell phone to silent mode. It's pretty easy to connect with legislators by leaving a note or contacting staff. Things get hectic around committee deadlines and at the end of the session. Be respectful of people's time, lack of sleep, and just general grumpiness. There's a myth that legislators are full-time positions and that they're paid a large salary. In Connecticut, as in most states, legislator is considered a part-time job, earning about $30,000 a year for most. Many have other jobs. Do not make assumptions about their views on your issue or others. Check first. Legislators are not elected for their policy expertise. They're elected to represent their constituents. They need your input, want your help, and will generally welcome you to the process. They rely heavily on their legislative staff. Leadership, the Speaker, President of the Senate, and other leaders have enormous power. Legislative staff are pivotal to the process. Many have been working in the legislature longer than most legislators. They work hard at a difficult job and keep things running smoothly. Partisan staff work for the party caucuses. Nonpartisan staff are civil servants without political affiliations. There are exceptional staff in both partisan and nonpartisan offices. Either can be important allies for your issue. OLR is the legislature's research office. OFA are the fiscal analysts. LCO are the lawyers who draft legislation. And committees also have staff. Remember that they work for legislators, not for you, but many are advocates for the causes you care about. There are a number of concrete tools for legislative advocacy in our Connecticut Health Policy Project Advocacy Toolbox.